Today in this lecture we will talk about the role of distal tubule and collecting ducts in excreting concentrated urine. Role of distal tubules and collecting ducts in excreting concentrated urine. Previously in our few lectures we mentioned repeatedly that the requirement for excreting a concentrated urine includes highly concentrated renal medulla or high osmolarity of the renal medulla and release of ADH antidiuretic hormone. So now we will look at how the ADH, the hyperosmolar renal medulla, helps the distal tubule and the collecting ducts in concentrating the urine. So we have mentioned repeatedly that when the glomerular filtration occurs, reabsorption of solutes and water starts from proximal tubule. Water gets reabsorbed from the proximal tubule, also from descending limb of the loop of Henle. But the thin ascending limb of the loop of Henle and the thick ascending limb of loop of Henle is impermeable to water. Water is not easily reabsorbed from these two segments. So you can see that water remains here, although a little bit concentration of the urine has started here. But when it comes to this segment, the fluid is still a little bit dilute. The fluid is still a little bit dilute. Now, depending upon the circumstances, whether we need to reabsorb water and conserve water and excrete a concentrated urine or not, depending upon the environment, upon the fluid deficit, there may or may not be secretion of large amount of antidiuretic hormone. But if there is a requirement to excrete concentrated urine, large amount of antidiuretic hormone will be excreted. These distal tubules, they keep on reabsorbing the sodium. Normally they keep on reabsorbing the sodium, but not water, which contributes to dilution of the fluid, which contributes to dilution of the tubular fluid. But if there is circumstances in which concentration of the urine is required, then what happens that large amount of antidiuretic hormone is released and it acts on the distal tubules and collecting ducts. And now these collecting ducts are permeable to water, and now water is being reabsorbed. Water is being reabsorbed in the medullary collecting in the cortical collecting ducts as well as the medullary collecting duct. So this portion is the cortical collecting duct and the remaining is the medullary collecting duct. Also, we have discussed so many times that there are different types of nephrons. Some of the nephrons are cortical nephrons, which with majority portion in the cortex, while there are some juxtamedullary nephrons which are diving deeply into the medulla. So when there is release of large amount of antidiuretic hormone due to fluid deficits, a lot of water is reabsorbed in the distal tubule, the medullary collecting ducts, and also in the cortical collecting ducts, in the cortical portion of the collecting duct, also in the medullary portion of the collecting ducts. But as we have mentioned that the osmolarity of the renal medulla, osmolarity in the renal medulla is very much high as compared to osmolarity in the cortex, and this thing is also very much important for concentrating urine. This is very important, and also it is important to maintain the high osmolarity of the renal medulla as compared to the osmolarity of the cortex. So what happens that the fluid reabsorption due to the antidiuretic hormone, it takes place mostly in the cortical region, the region which is also almost uh, which is less in osmolarity, already, and less amount of water is reabsorbed in the medullary portion of the collecting duct. Less amount of water is reabsorbed in the medullary portion of the collecting duct, and whatever amount of water is reabsorbed from the medullary or the cortical portion of the collecting duct, it is quickly swept away by vasa recta, which are peritubular blood capillaries, which are the blood capillaries present here. They quickly take away the water. So what happens is that due to reabsorption of water from the medullary and cortical collecting ducts with the help of antidiuretic hormone and with the help of high osmolarity in the renal medulla, the the urine in these tubules, it gets concentrated. Its concentration increases. Its concentration increases due to reabsorption of large amount of water as compared to reabsorption of solute. So that's how urine gets concentrated in the cortical collecting in the cortical medullary collecting ducts and in the distal tubule with the help of antidiuretic hormone in previously hyperosmolar medulla. Now, this thing not only helps in the reabsorption of water and aiding this water with the help of these blood vessels into the body, but it also preserves the high osmolarity of the medulla, which has been maintained, which has been formed with the counter current mechanism. Now, in the coming lecture, we will discuss some more uh, methods through which the concentration of through which concentration of urine will occur. Especially, we will discuss the role of urea in concentrating the urine. Also, we will discuss the role of urea in keeping the high osmolarity in the renal medulla. So, thanks a lot for watching the video.